We are at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association and, of course, the Common Bridge podcast and Substack. I'm your host, Rich Helppie. Today we're going to be talking to Representative Bill Schutte. He is a state representative from the 95th District of Michigan that is in Midland County. Representative, nice to see you.
Really appreciate the opportunity to be with you today.
And you've been around the conference a little bit. What's some of the topics top of mind?
Yeah, I was just talking on one of the What's the Fix panels earlier, talking about our state's economic outlook. And I think, the theme of this conference has been that Michigan's house is on fire, right? And I think, that's things like our population isn't growing fast enough, we're not attracting enough good high-paying jobs, and our reading is unfortunately, ranks 44th in the nation. So we have a lot of work cut out for us, but those are, as a state legislator, something I'm going to dig in and work hard to deliver real results in improving that.
Have there been many conversations around health care?
Absolutely. I think, in the state of Michigan, hear a lot about the cost of health care, making sure that we provide affordable, high-quality access to care. I know we're here on the Michigan Health and Hospital Association's recordings here, and I'll say in my district specifically, we have My Michigan is headquartered in the Midland area. And, My Michigan does a great job of making sure that residents in my district have access to high-quality health care, and that's incredibly important.
Indeed, it is. When you think about the impact of that health system on your community and your constituents, do you think of it as a business impact, quality of life impact, or some other way?
I think it's a little bit of both, right? I think as far as an economic driver, it's the largest employer in my district is the My Michigan health system. I will say also, it's great that people come to Midland to receive a high quality treatment of care. But Midland is where I live, the population center of the district. But you start in Midland, you go north in my district all the way up to Beaverton. My Michigan is the health provider, the major hospital system, and it goes all the way up to the Sioux, right? And that is so needed in a lot of our rural communities to have those hospitals that will step in and fill that gap.
There's been a lot of discussion around affordability.
Yep.
And what are you hearing from your constituents?
Everyone, wants a high quality of care that's as affordable as possible, and those are solutions I'm always looking to find and working towards. I think that's everything from making sure that we provide access to things like health savings accounts and making sure that we have the flexibility for Michigan families to be able to not be worried about how they're going to pay for the ambulance ride, but worried about how they can improve their life. Those are the difference we really want to make here.
If you were going to go to the legislature next session and advance a single cause for health care, what might you pick? There's a lot of them to pick from.
There's a lot. There certainly are a lot to pick. I think some medical debt is a huge issue in our state right now, and I don't think you want anyone to lose their home or their car because they had an unexpected medical emergency. And so making sure that we appropriately address medical debt is important. I'll also say, one of the reasons I think that health savings accounts are so great is we're empowering everyday Michiganders to use the cost to address their health needs, and it can be holistic. It can make sure that they're, getting the whole wraparound, not just going to the emergency room care, but the preventative care that they need to not even have to go to the emergency room. So those are the types of things I think we need to work on.
Those would be great policies
Absolutely.
to advance.
Yeah.
Any frustrations that you've ever experienced by yourself?
Yeah, I think obviously we live in divisive times, and that makes it hard to get policies done. But I think at the end of the day, you have to assume good intent and have as optimistic of an attitude as possible, which isn't always easy in this day and age. But yeah, you got to pursue it regardless.
Well, thanks for fighting the good fight.
Thank you.
On behalf of us. And are there any other comments that you'd like to end the segment with?
I would just say, we want our state to be younger and healthier and growing. And I think our hospitals play a huge part of that equation, and I want to make sure we're always working together to do so.
Well, I share your objectives. I'm not personally contributing to any of those things, but you can bring up the next generation.
No. It's a next generation for sure. So, yeah, awesome. All right, thank you.
Thanks so
Appreciate it.
much.
Absolutely.
We've been talking with Representative Bill Schutte of the 95th District, of our state representative. And on behalf of the Michigan Health and Hospital Association and the Common Bridge podcast and Substack, this is your host, Rich Helppie, signing off.